Farato Health Center is one of the minor health centers within the Western 2 Health Region in Kombo South District. The facility is located in Farato and covers the entire catchment area population. The facility covers 4 communities with a catchment area population of approximately 25,000 annually, according to the projection by the 2013 census. On Monday afternoon, the health center management presents certificates to staff and volunteers in recognition to their services. The ceremony attracts stakeholders in Western 2 region. On behalf of the Regional Director, Mbayang Jom, Regional Operations Officer for the extended program on immunization for the region, highlights the importance of data keeping and advise the staff to be more tolerant.
I would advise Farato Health Center, Mr. OIC, and his staff to have patience and respect. Once there is patience, we make sure we create demand for our stakeholders. Because if you're here and you are so patient to your clients, so patient to patients, obviously your demand will be very high, simply because the patience, the commitment, the concern you are showing to patients. Because at that particular point in time, this is what the individual needed. Respect among us. Once the respect is lacking, work might be very difficult within our environment. But to create that conducive environment, what do we have to do? We should have respect for one another to make sure things are going the right way and they are also done the right way.
Former Regional Director Ngaling Buakar Sambutu advises the staff to be more understanding at all times during their work.
I have been well informed by our Regional Director, Jandak Jaju, that there is more to come for Farato, from a fully fledged minor health center to a major health center and beyond. As a health worker, be it a cleaner, watchman, nurse, midwife, or public health officer, you need to understand that every time you are face to face with a client or patient, you are on trial. And at that moment of truth, the client or patient is both judge and jury, and the client or patient has ultimate power. That ultimate power is either to continue with your clinic, or even change personalities, even patients, or change to another clinic, or stay at home, even if this may lead to fatal consequences. As you continue to have hundreds of moments of truth every day, it therefore behoves on every one of you at this very health facility to make those moments of truth come out in the clinic's favor. By so doing, you will fulfill the aspirations of the Ministry of Health.
The officer in charge, Keba Eskinte, thanks the villagers for their efforts towards the upkeeping of the clinic and highlights the challenges they are facing.
Presently, we have a difficulty of staffs, especially midwives and the trained staffs, for the shifting of 24 hours is a problem. And also water supply. We are appealing so that we can have a water tank, we can have a reserve tank where water would be there. Because sometimes when water is out of the facility, we have labor case, we find it very difficult to clean our instruments, and even the patients also to take bath is a problem. And also the road network from the facility to the highway is a problem. The rainy season, all our clients, all our patients, even our antenatal patients, they all go to Brikama for delivery. We don't see any of them here. If you tell them, they will tell you the road is not good.
A public health officer, Lamin Enes Fofana, a staff at the clinic, highlights some of their achievements during the past year.
A total of 16,653 patients has been seen at the outpatient department seeking for medical care. Out of this, that is 4,703, which account for 28%, are patients under the age of 5 years, and 11,950, which is 72% of patients above 5 years of age. On average, the facility is seeing 392 patients below 5 years and 996 for above 5 years. And on total monthly average of patients seen is usually 1,388. Antenatal care is of paramount importance when it comes to birth preparedness for safe delivery. In that regard, the facility has provided antenatal care services to 3,318 pregnant ladies, of which 1,151 were newly registered and 312 were registered during their first trimester. And 3,318 have revisited the facility for their routine antenatal care services. In regards to the obstetric services, the health center has conducted 523 safe deliveries, of which 485, that is 93% of the deliveries, were all delivered by skilled personnel in the health facility here, whilst we had 4 still but were registered for the whole of 2021.
The facility has a labor ward, a general outpatient department, a neonatal child and adolescent health unit, public health officer, and general observation room, which provides both preventive and clinical services to the communities. Reporting for Kerr Fatou, I am Buba Gajigo.